Do you have Medicare and are confused about the recent changes in your pharmacy benefits in 2025? If yes, then this video is for you. I will try to make this as simple as possible, first going over the changes and then using an example. You can get Medicare drug coverage in two ways: the standalone Part D plan, if you have the original Medicare, or through the Medicare Advantage plan with drug coverage. And this is specifically if you get the Medicare benefits through a private insurance company. Previously, Medicare Part D had different stages that affected how much you pay. The deductible stage, where you pay the full cost of your drug until you meet the deductible. The initial coverage, where you pay a copay or co-insurance and your plan covers the rest. And the infamous coverage gap or donut hole. After spending a certain amount, you pay more out of pocket until you reach the next stage, the catastrophic stage. The donut hole has been shrinking over the years, and so costs are lower than in the past years. In 2025, there will be a $2,000 cap on out-of-pocket drug costs, making medications much more affordable for those with higher expenses. This will be a hard limit. After you spend $2,000 on covered medications, Medicare will pay 100% of the cost for the rest of the year. This is a major improvement because previously there was no upper limit. Patients with expensive medications could keep paying thousands out of pocket. Additionally, in 2025, once patients hit the $2,000 cap, they pay nothing for catastrophic coverage. Also in 2025, brand name and generic drug costs will stay more predictable throughout the year instead of jumping suddenly. There will be a continued extra help program and it will expand, meaning more people will qualify for financial assistance with drug costs, co-pays, and premiums. Bottom line is that in 2025, Medicare Part D will be more affordable and easier to budget. This is great news for people who take expensive medications. Now let's go over these changes using an example. Let's say Mary is a Medicare beneficiary who takes an expensive medication for a chronic problem. Here's how the 2025 Medicare Part D changes would impact her cost compared to previous years. Previously, under the old system, Mary takes a drug that costs $1,000 a month. She pays the full cost until meeting her plan's deductible, say for example, $500. Initial coverage, she pays 25% co-insurance for her medication, meaning $250 per month. After reaching a certain threshold, she continues paying around 25% for drug costs until she reaches catastrophic threshold. Once she reaches the catastrophic threshold, about $8,000 in total drug spending, she still pays 5% of her drug costs for the rest of the year. This brings her total annual out-of-pocket costs to about $3,000 to $4,000, depending on exact payment details. Under the new system, Mary still takes the same $1,000 per month medication. She pays like before until she reaches $2,000 out of pocket. But after this is reached, Medicare covers all additional drug costs for the rest of the year. So her total annual out-of-pocket costs are just $2,000 instead of $3,000 to $4,000. Additionally, instead of paying $2,000 in a short time, Mary could spread out her out-of-pocket payments over 12 months, about $167 per month, using the new Medicare prescription payment plan. Bottom line, with the 2025 changes, Mary saves at least $1,000 to $2,000 per year and doesn't have to worry about never-ending drug costs. Does this make sense? If you found this video helpful or even just a little bit entertaining, go ahead and hit that like button and subscribe for more health-related content. Let me know if you have any questions.